Dr. Prasanth Parameswaran, Senior Consultant, Medical Oncology and Hematology, MVR Cancer Center, Calicut. Today, next 10 minutes or so, I would like to discuss with you regarding what is lymphoma, what is a lymphatic system, what is its function, and how does this lymphoma affects our body. To be precise, it is an pretty common cancer. If you take the top 10 cancers in India, lymphoma will be one of the 10 cancers. The incidence of lymphoma is rising, but to be frank, nobody knows the exact reason why it's rising. So we'll be embarking on a journey which will know more about lymphatic system and how does it turn to malignant lymphomas. So our body is complex. It has got many things to keep us healthy. One such system is called the lymphatic system. Lymphatic system is actually a network of blood vessels, lymph nodes, lymphatic channels, and then certain organs. Organs, to be precise, it's mainly the spleen and the tonsil, and some to an extent something called the thymus. So let's understand what is the function of this lymphatic system. This lymphatic system is very important to our body because it's responsible for maintaining the body fluid balance. It helps for our immune defense. That's very important. It acts as the body's main immune function or protect against all the infections. Moreover, it's a key player in immune surveillance. There is something called white blood cells, lymphocytes, and the lymph nodes. So these are certain basic things which our body has as a barriers or defense against infection. And the lymph nodes are the command centers of the system, where immune cells meet and formulate a response to this potential threat of bacterial, viral, or whatever infections it is. Even if it's a cancer which is coming to the body, its immune system has got some surveillance to do in this part of things. So now, if you understood what is lymphatic system and what is its function, so it's very important. You can't avoid the lymphatic system. Now let's shift our focus to lymphoma. So lymphoma is a group of blood cancers. When in children, it's normally called as leukemia. In adults, mainly when it affects the lymphatic system, it's called as lymphoma. Lymphoma occurs when the lymphocytes or WBCs mutate and begins to grow uncontrollably. All the time, it may not be true, but majority of the time, it can be a B lymphocyte or T lymphocyte. This unregulated cell growth can lead to formulation of tumors in the lymph node, spleen, bone marrow, and other lymphatic organs. There are two main categories of lymphoma. Broadly, it is classified into Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin is basically by the person who found or discovered this lymphoma, and it is characterized by the presence of certain cells called Reed-Sternberg cells. That's basically a microscopic diagnosis. It tends to affect younger adults usually, but it has a bimodal age group where sometimes elderly can also present with Hodgkin's lymphoma. Non-Hodgkin's lymphoma is more diverse and it's more common than Hodgkin lymphoma. It's actually a basket diagnosis which consists of another 10 to 20 varieties of lymphomas, of which the most common thing which we encounter in day-to-day practice is diffuse large B-cell lymphoma, follicular lymphoma, mantle cell lymphoma, and others. So as I told you, it involves the lymphatic system. So the persons with lymphoma can manifest in several ways. So it's actually a challenging diagnosis. Most common symptoms include enlargement of the lymph nodes. They can have a lump in the neck, in their armpit, or something called the axilla, or sometimes in their groin. It can present with unexplained fever, weight loss, night sweats, and majority of the time it's the physician who has the clinical suspicion of lymphoma, and it comes or reaches us as a referral diagnosis. It can happen in any organs. You can have lymphoma in the lymph node, in the lung, in the liver, in the spleen, even in the brain. You can have lymphoma called the primary CNS lymphoma. So it can affect any organs. There is no particular symptom to tell that it has got lymphoma, but it's actually a group of symptoms where you have the suspicion of lymphoma. In advanced cases, it can affect some vital organs, and so basically early diagnosis is the key. Treatment options, or before that, once you are diagnosed with lymphoma, you have to undergo on certain workup or something called laboratory and histopathological examination. So majority of the lymphomas require something called tissue diagnosis or the biopsy. Either you take a lymph node from the neck or armpit and take it for an excision biopsy. If there is no lymph nodes palpable, then it may be a radiologically CT guided biopsy from the abdomen or inside the chest where you are taking a bit of tissue. So what I want to explain is that basically lymphoma is not a scan diagnosis. Lymphoma requires biopsy. It's a pathological diagnosis. It's very important for a biopsy because it's not only lymphoma, you have to prove which type of lymphoma because all lymphomas are treated entirely separately. Once you have diagnosed with lymphoma and the exact subclassification, that is done by something called immunohistochemistry in the pathology labs. After that, you need something called the staging investigation. For that staging investigation, normally these days you go through something called the PET CT scan. The whole body PET CT scan tells you the exact stage of lymphoma. Sometimes you require bone marrow examination to know any disease inside the bone marrow. It's actually depends from case to case. But otherwise, a PET scan and a biopsy is must before treating lymphoma. The treatment options of lymphoma has come a long way because I proudly tell that lymphoma is one of the diseases in oncology where the cure rate has jumped many folds. In fact, lymphoma is one of the most curable cancers these days. Advancement in chemotherapy, radiation therapy, and now there is something called targeted therapies and immunotherapy for lymphoma. The choice of treatment depends upon the type, stage, and the individual factors and the patients as well as the disease-related factors. But the take-home point is you should not be afraid of lymphoma because lymphoma is well treatable and more to an extent a curable cancer. So as I conclude this episode, I emphasize on the importance of understanding the lymphatic system, recognize the signs of lymphoma, and how to approach a patient with lymphoma, or if you are having a lymphoma, you have to undergo this tests, and then you should not worry for treatment because correct treatment, majority of the lymphoma are going to get cured. And the last point to add is, in our country where the tuberculosis is so endemic, the most differential diagnosis for a lymphoma is a TB. So all your lymph nodes, if you have a palpable lump, you should not think after hearing this episode that everything is lymphoma. It can be tuberculosis. So the biopsy is the one which gives the answer whether it is tuberculosis or lymphoma, whatever it is. But if it is lymphoma, then it is well treatable. You have to meet a medical and hematology oncologist, and you have to undergo usually something called chemotherapy. Some extent, some patient may require radiotherapy, but it's always 6 months treatment and it's very curable. So stay informed, stay vigilant, and continue to cherish your body's unsung hero, the lymphatic system. Thank you for your patient hearing.